Optimal health for high performers. This is the Health Upgrade Podcast with Dr. Nawaz Habib.
Hello, everyone. Welcome back to the Health Upgrade Podcast. This is Dr. Habib, and I'm here with JP. How are you, sir?
I'm doing really well. Thank you.
Wonderful. This episode of the Health Upgrade Podcast is brought to you by Truvaga. Have you been looking for a simple way to feel calmer, think clearer, and sleep better? Imagine achieving this with just 2 minutes a day. I'm excited to introduce you to Truvaga, a handheld device that supports your nervous system through gentle vagus nerve stimulation. As a doctor specializing in functional health and wellness, I've seen firsthand how Truvaga has accelerated healing in my clients. I've used this device to help people with a range of issues, from sleep disturbances and heart palpitations to digestive dysfunction, nervous system imbalances, and mental wellness concerns. The results have honestly been remarkable. Truvaga is designed to catalyze and accelerate the shift in your body from fight or flight to rest, digest, and recover mode, helping you manage stress, maintain mental clarity, and unwind more easily. It's not just theory. I've witnessed its positive impact on real people facing real health challenges. The best part? Truvaga fits seamlessly into your routine. No need to carve out hours for wellness. Just 2 minutes a day can make a difference. It's a small investment of time for potentially significant benefits in how you feel and function each day. If you're curious to experience Truvaga for yourself, visit truvaga.com/upgrade. You can save $30 on your device by using the code UPGRADE30 at checkout. Remember, that's truvaga.com, truvaga.com/upgrade. It might just be the first step towards a calmer, clearer you, just as it has been for many of my clients. I'm excited about today's conversation. We're going to dig into a really important topic, one that affects a lot of people. And a lot of people don't realize it, that there is a very strong autonomic / neuroimmune component to it, but it is to do with skin health. And we're going to talk a little bit about a few different conditions today. We're going to talk a little bit about the more prevalent ones, eczema being one of the most prevalent, acne, likely the single most prevalent skin condition, and a little bit into psoriasis as well. We'll talk about the autoimmune components there as well. But we want to dig into what causes these skin health conditions. What are the issues revolving around creating these challenges and these symptomatic conditions for a lot of people? And what can be done about it? What are the things that people need to look for? What are the things that we can correlate between a skin condition and otherwise? And dig into the pathophysiology a little bit on each of these conditions. Anything to add before we jump in?
Well, I just want to make certain that everybody sort of is oriented and thinking about the fact that we have 3 major connected microbiome systems in our bodies. One, everybody talks about the gut microbiome, but we don't really spend a lot of time thinking about the skin microbiome. I mean, the skin is our interface with the outside world, and it is, I hate to use the word infested, that's probably not, but covered in cells that are ours and cells that are not us, which are interacting with one another all the time. Even when you take a shower, you come out, you still have billions, if not trillions, of bacteria and fungus and viruses on your body that you are interacting with. And your immune system has to know how to tolerate it. And there's pH issues, there's frankly neurotransmitter issues. But then we also have the airway microbiome. I mean, we think of our lungs, sort of as these bags of air that we keep inside us, and they, expand and contract. But the surface area is so large because of all the nooks and crannies inside our lung tissue that it's actually 80 square meters. It's larger than our skin, actually. And so when you think about some of the conditions you were just talking about, things like atopic dermatitis and eczema and psoriasis, there are parallel conditions in the gut and in the airways, things like asthma. In fact, people refer to eczema or atopic dermatitis as asthma of the skin. And then you've got situations in your gut, things like, IBD, which would be a parallel to psoriasis as an autoimmune disease. And you have IBS, which is sort of more like that hypersensitivity type reaction like atopic dermatitis or eczema. And then, that is a parallel again. So the idea of looking into what is the microbiome's role and how we interact with it in terms of these different conditions, it just makes sense. So that's the orientation of what this conversation is going to be all about, I think.
I love it. And I had a very interesting, I guess, a lesson a while ago when I was starting in my functional medicine kind of training. And I remember even before in my chiropractic college training, being a chiropractor, working hands-on with people, we had a lot of contact with the skin, obviously, right? We ideally are able to see what's going on the skin, make sure that it's skin-to-skin contact when we're doing adjustments or soft tissue therapy. And that always created this thought process of what's going on the skin is really important to note, right? We don't want to always just go through clothing and not notice that there might be something going on. There may be a melanoma. There may be some sort of acne or some other skin type of condition that is present on that person. And as the doctor, as the person who's taking care of this patient, we should definitely be assessing these things. And then when I got into the functional medicine side of things, we started to understand that pre all of the functional lab testing, where we're able to identify what's going on with the gut microbiome, where we're able to finally see what's going on with urinary organic acids, even deeper than going for looking at blood work. One of the greatest tools that was utilized as an old world diagnostic tool was looking at the skin, the quality, the oiliness, the rigidness, the dryness, all of these things were taken into account as a diagnostic tool by healthcare practitioners of the past, to the point where skin is the window to what's actually happening inside the body. I think that is such an interesting way of kind of looking at it, because before we could do the testing, before we could identify what was going on in the gut, before we could identify what was going on at the cellular level, we started to show symptoms on the skin. And it was the doctor's job to look at the skin, identify, assess, and come up with some sort of option or some sort of diagnostic tool to figure out what was going wrong. And so what you've done there is you've aligned that there are conditions on the skin that are strongly associated with internal conditions that are very, very important to note. One of the things that I like to do just quickly as a functional medicine practitioner is note that you mentioned eczema is almost like asthma on the skin. If we see that, then we know that something is going wrong, potentially in the lungs or potentially microbiome wise, because the internal microbiome in the gut and in the lungs is directly associated with what's happening on the outside as well. There is a very strong correlation. Different population, different species, different balance, but imbalance inside will often show up on the outside. And so when we see imbalance occurring internally within the gut, within any other area within the body, we're going to see that show up on the skin. And it's our job now, not necessarily just the job of the doctor, but it's our job to identify as individuals that something is incorrect or something is not working ideally. And I think that's where we should be empowered to start looking at these skin conditions with the deeper eye, that it's not a skin condition is not simply a skin condition. I think that is huge to understand. The skin is more a window to what's happening internally within the body, and it's showing us where the imbalances are taking place.
You just stole my thunder. I was going to say, we think of the eyes as the windows to the soul. Well, the skin is really the window into the interior of your body and how it's functioning. And I'm reminded of something that I learned early on when I was working in the spine field. One of the people that I was working with happens to be my uncle. He's a world-renowned spine surgeon. He shared the history of his education in practice. And it was an older physician who had told him that prior to doing spine surgery, he could tell whether or not the patient was going to have a positive outcome or a negative outcome from, spine surgery. We're talking something very invasive. He could tell simply by running his fingernail across the skin of the patient's back and basically just, sort of doing a light scratch across the back. And what he found was that most patients had very little response to it. Some patients would you'd see a little red mark or a red line. But for a small percentage of the population, probably around 10%, he would see that the response to that was a raised welt. We've talked about this a couple of times, I think, before, but a raised welt would be triggered by something as simple as your fingernail running across your skin. And he had identified that patients who had that response had negative responses to surgery because their immune systems and their nervous systems, as we now know, their nervous systems weren't in a place where healing properly was going to occur. And so, yeah, the skin can be the window into how your body is functioning. And so I think it's worth now sort of digging in with that sort of framework on some things like, let's start with acne, because to me, God, it's probably every teenager goes through it. And of course, that's a period of time when there's lots and lots of hormonal changes that are happening in the body. And those hormonal changes have effects on your immune system. Before we came on the air, you pointed out and you wanted to make certain we remembered to talk about the female cycle and what it does to, women's complexion at different times in the cycle. And that is tightly aligned with how the immune system is functioning. And so that we've talked many times about the immune barrier that sits between the inside of the gut and the gut lining. Well, you have the same kind of structure in skin. Skin's thicker. It's not one layer thick, one cell thick, but there's a tremendous amount of your immune system that actually is in your skin. And it is monitoring the interface between the outside world and that microbiome and how your immune system should be responding. And so there's really four basic ways in which the nervous system and your immune system interact to trigger things like acne or atopic dermatitis, et cetera. The first is really cortisol. Cortisol itself is really important because it controls the oiliness of your skin you were just talking about. And when the level of oil is different, it's just a function of fatty acids versus, how much, oil versus hydrophilic versus hydrophobic phobicity there is in the skin. And different bacteria and different life forms survive and thrive in different environments. And it just so happens the ones that thrive in the oily skin are ones that can be pathogens. So that's the first one. Do you have any thoughts about? Cortisol we know is triggered by stress, but any other? We've talked about cortisol many times.
We have. I want to add in that cortisol does have a daily 24-hour rhythm that it follows, and so the idea is cortisol will rise with your awakening response. It's the cortisol awakening response that occurs, and that's essentially what causes your body temperature to start rising and initiates your awakening response as you wake up in the morning, and then you continue on through the day, and your cortisol will level off or later in the morning and then start to come down and decrease in the afternoon, ideally, and then be able to level off to as low as possible before bed. Because what you're doing is when the day begins, when the sun comes up, ideally you're waking up and you are showing up with the world. And so there will be a 24-hour pattern because of the 24-hour cortisol pattern. There will be a skin pattern that follows that. And so that's just something to keep an eye out for, that the oiliness and kind of the perspiration and the contents of perspiration will be a little bit different in the morning versus in the evening because of that cortisol awakening response and that 24-hour rhythm.
Yeah, for sure. The next of the four things that really affect how your skin reacts to bacteria in your microbiome and can lead to things like acne and atopic dermatitis. The second is pH. And we don't really think of skin, because it's just a solid surface, as having a pH associated with it. pH is sort of the acid versus base content. But the human skin is actually very acidic. The environment around, of your skin typically has a pH of around 3, which is really, really low. Your stomach acid is only at about 1.5 to 2. So that level of acidity helps to maintain the right level of safety, if you will. As in fact, we talk about a lot, surface, and that is actually makes you a little bit more susceptible to bacteria that shouldn't survive on your skin being able to. And that's not to suggest that people shouldn't take showers or wash their hands. I'm not saying that. But I am saying that after you wash your hands, it's probably not really a great idea to immediately put your hands into an environment where there are bacteria that you probably don't want on your skin. You'd be much better off actually having, dirty skin and unclean skin in that environment, because then you allow the acidity of your natural state to defend you. And that changes. And we know this. Think about our stomach acid production. When you're stressed and when you're in that, we talk about, oh, I've got a stressed stomach, my acid levels are really high. Well, yeah, that's identifying that there's this pH imbalance that can occur in your stomach, but it also happens in your skin. And so you lose that protectiveness that happens at that pH level because of stress. And that leads to a reduced level of biodiversity in your skin. You want to have, just the same way you want to have lots and lots of different types of bacteria in your gut that are good for you. You want the same thing in your skin, because when you don't have that, then the pathological or the pathogens can reproduce easily, and you end up with acne forming. So that's another one. pH is it's something I think is pretty important all the way around, but definitely in your skin.
You also mentioned washing your hands then for the short term following decreases that acidic protective capacity that is available there. I'm not sure how many people are aware of this, but BPA, bisphenol A, is a very, very toxic chemical that's meant to soften plastics. So there's hard plastic and then there's soft plastic. Really simple example of this. Hard plastics are like the toys that kids play with. Soft plastics are like water bottles. There's a lot more BPA in those water bottles to soften that plastic up, to allow it to be a little bit more malleable and a little bit easier for us to utilize in theory. The problem is that BPA gets into the body very easily and triggers major xenoestrogenic effects, meaning that it mimics estrogen within the body, which is very, very bad for us. Now, when you wash your hands, when you even just get some water on your hands, you increase the porousness of your skin. The pores actually begin to open up. And the idea is you can release toxin out and get rid of things that are inside your body, but it also increases the absorbability of anything that's outside. Now, one of the places where BPA enters your body, and people don't realize this is a lost source of BPA, is receipt paper. If you've ever picked up a receipt and felt kind of that sliminess on the edge of the paper, like the paper doesn't feel like a piece of regular paper or like a piece of mail, an envelope, anything like that. There's almost a sliminess to it because it gets printed through that receipt paper machine. You're leaving Costco, you're leaving whatever shop you're going from, they hand you a receipt. If you go and you hold that receipt paper in your hand, particularly if that hand is wet, sweaty, or has been washed, the absorption of BPA into the body accelerates drastically. So, number one, recommendation on this. Number one, don't touch a receipt paper with wet hands. Number one. Number two, minimize your contact with receipt paper because those toxins will enter. I know we're going off of skin conditions when I'm talking about this, but just note that a lot of toxins can enter the body through the skin. We tend to think of toxins entering via the gut, which is very susceptible to allowing toxins in. The barrier is much thinner in the gut, but our skin is susceptible. And it's usually through the pores that these challenges start entering our body. So be really, really careful with things like receipt paper. Now, when the pores get clogged, that's where acne pops up, right? Acne is essentially a clogged pore and then a raised inflammatory issue around that pore that holds on to some sort of bacteria. I'd love for you to dig into that a little bit.
Yeah, well, that's actually really important because it's the altered immune state. We've talked, many, many times. Sort of a fundamental theme of our podcast is to talk about how the autonomic nervous system affects the immune system. Well, that happens in the skin as well. And, just to orient people, we talk about tissue resident macrophages of the skin or of various different organs in the body. In the skin, they're called Langerhans cells, which is confusing because they have Langerhans cells in your pancreas as well. But that's different. Those are Isle of Langerhans cells. What we're talking about are really your tissue resident macrophages of the skin, of the dermal layer. And those can become activated into an inflammatory state simply by having too much chronic stress in your life. We talk about, I'm breaking out because I'm so stressed. I mean, how many times have you heard somebody say, I'm having a breakout because of stress? I used to hear it in college. Everybody would say, oh, I'm going through finals and my face is breaking out. Okay, well, that's a function of the fact that you've got a lot of stress. You're still young, so you got a lot of hormones. And there's this tension that exists between stress and the immune cells becoming activated. When they become activated, they actually become dysregulated with respect to really important molecules that are involved in that relationship between bacteria and your skin. There's a class of them called defensins, which sort of makes you wonder how creative the people were that came up with that. There's another group called cathelicidins, and these classes of molecules are really important for just maintaining that tolerance between bacteria and the immune cell. Because as you said, you've got the combination of oiliness, clogging pores, activated macrophages disrupting the relationship and the communications between bacteria. You're increasing the level of pathogenic bacteria. You're secluding them in a sort of a warm, dark, yummy place for them because there's all these fatty acids. So they're going to grow and multiply. You've got your activated macrophages bringing in all sorts of, cytokines, TNF alpha, IL-6, IL-1, et cetera. That's further disrupting things. And if you're in that stressed environment, you got the cortisol, that's having its effect also. So at the end of the day, it's sort of this four-pronged approach that's negatively impacting the environment in your skin, and you end up with a zit. And that acne, we talk about sort of that white pustule, stuff that builds up. Well, that's part of that whole immune, sebaceous, oily combination trying to defeat the bacteria. So it's frankly, it's like a form of pus. And I know that's rather disgusting, but at the end of the day, it's all a function of the relationship between your immune system, your autonomic nervous system, and the bacteria that are around. It's a form of dysbiosis, much the same way you could have dysbiosis in your gut microbiome.
Yeah, dysbiosis is, I think, a key word in today's episode because dysbiosis we generally link to gut dysbiosis, gut microbiome dysbiosis. But dysbiosis on the skin is a real issue as well. And there are some very particular signs that we can look for in people to see whether dysbiosis is happening. So I'll go back to kind of the old world wisdom, right? Of what are the things that we can identify in ourselves without any specific testing? We're not going to obviously be able to identify species of bacteria that are present by doing these tests. But if your sweat is very, very oily, there's a sign that something is dysregulated internally and that you are in need of some sort of balancing within either the gut or specifically within your toxic burden, your toxic load. Because what's happening is the fat soluble toxins are exiting via that sweat at a very high level. And what we'll often notice in that type of sweat is almost a different smell to it. Okay. That there's a different smell to that type of sweat that's being released. You had a really bad meal, you've had maybe too much sugar, too much carbs, or food that you shouldn't have been eating, and those toxins are being released through your pores. Alcohol is a big one as well, right? You can often smell the alcohol coming off of somebody the next day if they've had too much to drink. So these are signs that your body is trying to release these toxins, and we release toxins through three pathways. Toxin releases through urine, stool, and sweat. And if in any of those three pathways are burdened, limited, not able to function well, the burden will then fall on the other two to do that. And worse off if two of those pathways are blocked. Liver detoxification is piece one, and then those toxins need to be released out through those three channels. So if you're constipated or you have gut dysfunction or dysregulation, you're not able to eliminate those toxins, the burden will fall on urine and sweat. And you'll tend to notice that the sweat smells more. It smells different. It smells more pungent. That is a direct sign that you have a detoxification issue, and that a lot of that burden is falling on the sweat to release those toxins out. And that, if that happens consistently, is actually decreasing the acidic environment on the skin, allowing for more bacteria to show up and be present. And that results in another sign that we should look for is something like body odor, right? Certain types of smells or certain toxins that are building up are releasing these body odor type smells that people then exhibit. And obviously those will happen in areas where more sweat is going to take place, the folds of the skin, the armpits, the groin region, things like that. So we want to be really conscious of the sweat smells and the body odor smells, and just how oily the sebaceous glands and the actual sweat itself is. So those are all signs of detox issues, but skin is a great way of identifying and supporting the detox pathways when it's working effectively. And that tells us that one of those three channels may be blocked.
Yeah, and when we know this, because I mean, it's sort of, maybe not PC to say so, but there are certain foods that people eat that are very obvious when they come out through your skin and your pores. I mean, I'm Italian, and people used to say you sweat garlic. Not to me personally, but to the idea of Italians eat a fair amount of garlic, and that can have an effect on the smell of your sweat. Same thing with people who eat curry. I mean, curry can change your smell. And, it's something you have to get accustomed to. Same way everybody sort of got accustomed to garlic. It's everywhere now. It's not just in Italian food. So, but there are other things that can happen that aren't part of food that happen in your gut that end up coming out through your pores. And, it's not sweat that causes it. I mean, people say, oh, you smell bad because you're sweating. No. And in fact, I've got 4 kids, and I will tell you that the smell of sweat on kids, and kids going through puberty is very different from an adult who's, I can tell you that if, my son, who's, at this point 17 years old, and I were to go out running and sweat, in the Florida heat and come inside, we have a very different smell. I'm 56 years old. I don't have the same level of hormones and other things flowing through my system. Plus, I'm a pretty committed carnivore, and he's not. He's eating pizzas. And, so we will smell different because of the things that we eat and our age and the level of hormones that we have, which is, again, one of the reasons why hormones affect your acne level. And we've spent a lot of time talking about acne, and I want to make certain that as we sort of wrap up the acne piece before we go to things like atopic dermatitis and eczema, there's one other of the 4 prongs that I've wanted to talk about. And it's just directly norepinephrine. So norepinephrine, as we know, is the neurotransmitter associated with your sympathetic nervous system. And when you're in chronic sympathetic activation, you're releasing lots and lots of norepinephrine. Norepinephrine is actually used. It is actually taken up by bacteria, and specifically the bacteria Staph aureus, which is one of the things that causes sort of that really pernicious acne that some people end up getting. So stress, changing your stress levels and changing your sympathetic parasympathetic tone balance can have an effect on your skin quality. So I know that we spend a lot of time talking about how to balance your autonomic nervous system and how getting into parasympathetic recovery mode is so beneficial. But for those people who are suffering with breakouts and acne problems, I would absolutely suggest, incorporating deep breathing techniques, meditation, or if you don't have the time and you want to do something, a vagus nerve stimulation device. These things absolutely can affect your skin quality. In fact, we know when women get pregnant, we say they have a glow about them. It changes their skin. And there's lots of reasons for it, but among them is the massive suppression of the typical immune responses. Women who are pregnant are at much lower risk for having flare-ups of things like IBD, psoriasis, that autoimmune disease of the skin. They have a much lower risk of heart disease or atherosclerosis. Not that that typically happens at that age group, but pregnant women are typically, never have cardiac problems because the immune system is suppressed because the mother is now carrying non-self for 9 months. So all those signs lead to a reduction in the immune system and a glow about them. No zits, no breaking out. It's just good for the skin, etc. And it's all because of this reduction in the immune system.
Yeah, that shift away from norepinephrine. Because you've kind of gone there, I want to just point to where we get inoculated with the microbiome is primarily through the birth canal. So you mentioned the pregnant women, when they're giving birth, and ideally that baby is coming through that birth canal, that's where the bacterial inoculation of the skin and the gut microbiome and the lungs actually initiates. That's the first instance in which the baby's skin is exposed to and is inoculated with bacterial, species. That's the first step. And one of the really interesting things that has taken place over the last 15, 20 years, I believe, is this idea of skin to skin contact between baby and mother or baby and father in certain situations, immediately following birth for a good chunk of time. That skin to skin contact, that holding the baby skin to skin directly, is actually supporting that microbiome inoculation on the skin surface as well. Due to various reasons, both of my children were cesarean section born, and they didn't have the access, all four of yours, they didn't have the access to the birth canal as they were being born. And so and I specifically was very adamant about that skin to skin contact happening for a couple of hours after they were born, right off the bat. And remember just how small and beautiful and wonderful that moment was, holding my daughters in my arms. I also remember the back pain of being in this rigid position for as long as I was. But that moment is very important. And a lot of people don't think about those instances. So if you know somebody who is pregnant or considering having a baby, make sure that they're aware that that moment is so important, and that skin to skin contact is very beneficial for that child's health and long term. I even to this day, on my intake form, one of the major questions that we ask is, were you a C-section baby or were you a vaginal birth baby? And what happened, what was going on, how much antibiotic use did you have as a child? Were you killing off the microbiome? Because there are strong correlations to a lot of these skin conditions when there is a lack of bacterial inoculation with the right population of bacteria that is going to be supportive or beneficial.
Yeah, it's not just skin. It's also gut and it's respiratory. I don't know the statistics, but it would be very interesting to do a study looking epidemiologically at the prevalence of conditions that are far more prevalent today than they were in the past. Things like asthma, things like eczema, things like IBS, and look to see whether or not they are of higher prevalence among people who were C-sections versus non-C-sections. Going along with the idea of trying to recover that inoculation of the bacteria using skin to skin contact, there are physicians, OBGYNs, who during delivery will actually try to take a sample of, if it's going to be a C-section, try to take a sample of the microbiome from the mother and literally, wipe it in the mouth and on the skin of the baby coming out of the through a C-section, the baby is basically sterile at that point, and it's in a relatively sterile environment, and because you have to go through surgery to do this, a C-section. So there really is a dearth of positive microbiome interaction that needs to be replaced. So this idea of taking a sample of microbiome from either the mother's mouth or other orifice and literally wiping it on the child is actually a very, very positive thing to do for the child.
I just looked it up because you asked, and there was a study done in 2022 in the European Journal of Pediatrics, and it showed that prevalence of eczema between cesarean-born and vaginal-born infants within 1 year of age, systematic review and meta-analysis, and they showed a conclusion of 28% of cesarean-born infants within 1 year of age develop eczema versus 20% in vaginal-born infants.
That is interesting. I wonder whether or not in asthma or in IBS later on in life. I mean, we already know that there are, there are a lot of differences, and not to rehash the politics of this, but the prevalence of cesarean sections, or the frequency with which children are being born with cesarean sections, is really a function of litigation that came up in the United States back, I want to say 20 to 25, 30 years ago. There was a theory that was completely non-scientific that was suggesting that the incidence of cerebral palsy was higher because of a refusal by physicians to do cesarean sections, that the hospitals and the doctors were conspiring because it meant more work for the doctor and more time in the hospital for the patient. So they pushed women to have babies vaginally when they shouldn't have, and that they should have had cesarean sections. And tens of millions, if not hundreds of millions of dollars of lawsuits were won based on this non-scientific theory that isn't true. But it changed the medical practice. It changed how physicians who were, OBGYNs approached delivering babies. Now, at the drop of a hat, if there's anything that suggests even just, scheduling, if any reason they think that there's a risk, they're going to go with a C-section. What did that do? It increased maternal death in childbirth. It had zero impact on cerebral palsy, but it has had an effect, as you just said. In a study, 40% more children end up with eczema in their first year of life simply as a result of having gone through a C-section, not been properly inoculated. But I always say to people, we're not going to fix the past. My son, I remember I got angry about something that he had done, in the past. And he just looked at me and says, I can't fix yesterday. Okay. So if we can't fix yesterday, how can we fix tomorrow? And the question is, if we're not really going to change back to fewer C-sections, is there a product? I mean, think of it. Is there a product that we should be giving these children, a surface cream, something that we put in a nebulizer? Is it something that they should swallow that will provide them with an equivalent? No, I don't think we're ever going to get superior to Mother Nature, but can we get something that's approaching equivalent inoculation of a positive microbiome?
Almost like a probiotic mist spray of some sort or something along those lines, which would make a ton of sense. I've seen some probiotic sprays around to support internal environments of homes, but not for post-childbirth. I feel post-cesarean particularly. I feel like that's an area, and somebody who's listening is going to make a lot of money off of something like that.
Is going to do that, and just it reminded me as you were saying that there's been a recent study that came out to show that if you work and live especially in homes where there's regular use of, regular cleaning, where you're really almost sterilizing surfaces that you come in contact with regularly, that it has a very deleterious effect on your lung capacity, and I would imagine on your skin health. And I think that is a function of the fact that we need to live in an environment that is attuned to our microbiomes.
100%.
If you're constantly cleaning everything with Lysol in the house, not that Lysol itself is toxic. That's not the point. What it is you need that microbiome. You need and you are creating your own home. You're creating your own castle, and it is coated with your compatible microbiome. That's why when we come home, we literally feel different if we come home to our own home versus coming home to even a nicer home that isn't ours. It is because it is part of us. We become our microbiome is infused in the inanimate objects around us. And as a result, it is part of us.
No question about it. The home idea, I think, is such an important one. And the idea of constant cleaning for me actually is adding to this antibiotic resistance type bacterial superbug type situation that is starting to really take place in the world. And I think that's an important link to a lot of skin conditions as well, that we're not allowing the bacterial population that we've been symbiotic with for the vast majority of our history to allow us to be in that symbiotic area, that particularly beneficial inoculation in our homes, right? And if we're killing them off, if we're cleaning constantly, like, listen, we all like a clean home, but maybe we're not supposed to use the antibacterial killing tools all the time. Maybe there's a rate that's a little less deleterious or less challenging for that bacterial population and allows your home to be healthy for you. And I think that's a really important point. I'd love to dig into the eczema piece a little bit and the atopic dermatitis piece. Let's dig into those conditions.
Well, atopic dermatitis and eczema. I mean, atopic dermatitis, what does the name mean? It means you got what looks like a skin infection, but it isn't because we can't find a pathogen. So you're having a reaction that's itchy and red and inflamed and immune. You could see the inflammation. And yet there doesn't appear to be a rational scientific explanation for it, which is really when they say there's no medical explanation, what they really mean is there's no local thing that we've sampled that we've figured out why it's caused. But that doesn't mean there isn't a scientific explanation. It's not magic. Okay. And typically, the cause of those things is a central problem. It is a central nervous system issue. And we know, because we've been through this, that central nervous system issue isn't that you were thinking about something itchy. It is because something stressful is happening that is driving a chronic stress state or an imbalance in your autonomic nervous system in the direction of pro-inflammatory, norepinephrine releasing, effects that lead to those Langerhans cells becoming inflamed. And so you end up with an inflammatory. It is inflammatory. There's no question. I mean, it's red, it's raised, it's itchy, it's got it can be painful. It's got all the hallmarks of inflammation, but it's caused by the autonomic nervous system. And how do we know this? Because it's stress induced. We know that your eczema is worse, just the same way you can stress induce an asthma attack. In fact, they call eczema the asthma of the skin. So all of these things that we're experiencing that are uncomfortable are related to something that we ourselves are creating. We are and I always say we're not making it up in terms of like our imaginations, because that's up here in your prefrontal cortex. Your default mode network is not responsible for your eczema, but in your brainstem, maybe 5-6 inches away, that's where, not even 5 or 6, 4 inches away, that's where you're causing your own eczema. And I realize that there's people out there who are suffering with it who say, that's ridiculous. But I challenge you, if you have eczema, and I know because I have a daughter who had it and bad to the point where she scratched herself to the point of bleeding in her sleep because of this. If you try vagal activation, you will find benefit. You will find comfort. You will find a relief that you're looking for. And it doesn't have to be a device. It works really well. It worked for my daughter with a device really well. But try things like meditation. Try things like stretching. Try things like, deep breathing. These things have a positive effect on the autonomic nervous system and will downregulate the very things that are triggering and causing your eczema.
We really need to start to look at all of the sources of stress. And I know you and I have talked about this both in our books and elsewhere and in these episodes, but it's not always just a biological issue, right? It's not a bacterial population issue. There's got to be some other forms of stress that can be triggering these issues. And it can be physical stress, it can be emotional stress, which we talked a little bit about, day to day psychological, like challenges of childhood trauma and PTSD that are correlated to a lot of these health conditions that are inflammatory. Because what's happening is these stressors, when they become chronic, overwhelming stressors, they push the immune system into a primed for fight state. And what that does when they're primed for that fighting is they initiate the inflammatory response more readily and more prevalently. And they lack control through the vagus nerve, through the autonomic branches, the parasympathetic branches, the acetylcholine based support that pushes away from that primed for fight into that fix state and healing state. And we cannot heal if we're stuck in that primed for fight state. We cannot initiate that healing response. And that's where a lot of these vagal activation exercises, autonomic shifting tools, helping to re-regulate your nervous system back into a parasympathetic mode as your default through meditation, through deep breathing exercises, humming, chanting, gargling, singing, vagus nerve stim, devices, whatever the device, the tool, the exercise that works well for you, and you may have to try dozens to find the best option or any combination of these to help create that shift from fight sympathetic mode into fix parasympathetic mode. That is what all of this comes down to, because the neuro component is what regulates whether the immune system is in fight or fix. And that neuro component can only be initiated through that vagal activation, through those specific day-to-day practices that help to re-regulate you and allow you to get into a state of feeling safe, capable, and resilient. That's what all of this comes down to, I think.
I love that fight or fix. I love that dichotomy because we talk about fight or flight all the time, but fight or fix. You can't be in both states. You can't. It's like you can't put out a fire with an axe in your hand and and a water cannon, and at the same time think that the next day you're going to be able to walk into that building and it's going to function. You're going to have to fit. You have to stop everything and then fix. And we need to remember that. And that's what our bodies. That's where the relationship between the microbiome, we've talked about so many times, the four most fundamental systems in our bodies. And I think for frequent listeners to our podcast, they're going to get that the autonomic nervous system is important. They understand that the immune system is really important. And I think even whether they've listened to us or not, they understand that mitochondria and generating energy in a healthy way is really, really, really important. It drives every biochemical process in our body. But I don't think people really, really get how important the microbiome is. And the microbiomes are that are part of us. And we are, not just symbiotes with mitochondria, but we're symbiotes with the trillions of life forms that are in our gut and our skin and our airways. And there are so many conditions that we are experiencing now as a first world Western society that has antiseptics and antibiotics and all these things that are just clearing out any kind of worry of bacterial contamination and yet we're suffering with more allergies, we're suffering with more asthma, we're suffering with more eczema, we're suffering with more IBS, we're suffering with more depression, we're suffering with anxiety disorders. All of these things are a function of the fact that there's a dysbiosis. Think about the word dysbiosis. Biosis is life. And it's like somehow we've removed the life. We've disrupted the life. And the life isn't just ours. It's the environment that we put around us. And we have to get back to a healthier state. It'd be interesting to see whether people, and we know there's a higher prevalence of asthma. I wonder whether there's a higher prevalence of eczema, but I would assume that there is, and a higher prevalence of IBS in city environments versus rural environments, where in rural environments, you're near the dirt, you're near the earth, you're near that
The air quality issues are way better, right? Like you're not dealing with air quality control issues and smog and whatnot. Yeah.
It's air conditioning.
Yeah.
When you're in rural environments, you're not in a building that has 17 layers of air control and industrial filters that are purifying the air. I mean, you have an air conditioner. Listen, I live in Florida. I got air conditioners, but I know that if something happens outside that has a distinct odor to it, it can get into the house. You live inside a multi-story apartment building in Manhattan, not so much. You're not getting that.
No, not at all. And we do know that that indoor air quality actually is significantly worse than outdoor air quality because we don't have the plant life to help filter out a lot of the air in our homes, right? We're killing off a lot of the bacteria that might actually be doing some good for us in terms of clearing out air.
And it's really important to distinguish between air quality and microbiome in the air, because air quality doesn't mean it's cleansed of the life. What air quality means is you got soot, you've got toxins, you got heavy metals in particulates,
PM
things
2.5s,
like that.
yeah.
That's death. Okay, there's nothing living in that air contaminants. That's what you're getting when you're in that office building under neon lights and there's 17 layers of filtration that are getting before that air gets to you. In the rural environment, in an environment where you're much closer to the earth and ground, the air filtration, it might have more living dirt, living particulates in it, but that's healthy. Yes, when you're living in a cave, there's lots of biology, not a lot of toxin, a lot of biology. And that's what we evolved in. That's the environment we evolved in. That's what our bodies are attuned to. And when you remove it, it's not a health thing.
On the diet side, I also want to recommend, are you eating organic, or are the foods that you're choosing filled with glyphosates and pesticides and herbicides? Are they sprayed with a bunch of stuff? Are there a bunch of artificial fillers and chemicals being added to it, like food colorings and food dyes? These are all negatively affecting the microbiome, not just in the gut, but also on the skin. The gut microbiome and the skin microbiome work together. They're not separate components. The skin is not separate from the rest of your body. These things are all working together, right? Yeah.
Right,
oral,
nose,
nasal,
mouth, and your skin are all together right on your face.
And on the other side too, right? The anus and the skin are connected, right? It's two different parts of the same system that we've defined and separated in our, biological kind of learnings, that these are different systems, and yet they all are so inextricably connected and linked. So it's so important to note that what you put in your body will affect your skin. I've seen that happen. My niece has terrible eczema when she was living in Toronto. She moved to Portugal, and that eczema essentially cleared up just simply by her moving out there. I also added vagus nerve stim into her care protocol, and that's been nice. But just simply by not having the same exposures to what was being sprayed on her food here and shifting her food to what's over there, every time she comes back here, almost immediately the reaction is back, sadly. So identifying the sources, trying to figure out what's going on with the microbiome, really trying to identify all forms of stress, biochemical, physical, emotional, psychological stressors that are around us, avoiding access to these toxins that cause microbiome dysbiosis to occur, minimizing the things that shift us into that fight mode, and maximizing the time that we spend pushing our body into fix mode, right? You want a firefighter to put out a fire, but you don't want that firefighter rebuilding the house. You want carpenters, and you want specialized tasks and tradespeople coming in to fix when the issue is there. But the firefighters can't fix. That's not what they're trained to do. So you want to have the neural mechanisms around to be able to say, firefighters, we're good for now. Let's shift you and let's call up the carpenters and the drywallers and the plumbers and the electricians and get those guys in to do the fixing, because that's what we need in that moment. But unfortunately, so many of us are primed to have the firefighters there all the time. The fixing mode does not turn on. And that's what skin conditions alongside a host of other inflammatory conditions are occurring, because we're shifting into that other mode.
Now, I think this has been absolutely a brilliant conversation that went in lots of different directions. I just want to make certain, as we sort of close out this topic, that we don't leave people thinking that somehow we're condemning Western culture or Western society or, the advances in science. It is because of them that we have come to understand. But now we need to implement. And so we're not condemning what happened in the past. I can't fix yesterday, but I do want to let people know that the culmination, the next stage of this knowledge gathering is to implement it in a way that helps everyone. So as we always say, if you've listened to this and you understand this, share this with other people that you know who need it. And I guarantee you, with respect to the conditions we talked about today, dozens of people who have these problems. And share this information with them. Share with them that the microbiome is really something that you need to concern yourself with, and make certain that you're feeding it properly, both in your gut and your skin and your airways, with the right environment, and that you're not intaking glyphosates or, frankly, analgesic medications that are going to nuke your microbiome. And that's the same with your skin. Be careful what you put on your skin. Be careful how often you clean your skin and the ways in which you clean your skin, because it will have an effect on your microbiome's health, and that will have an impact on, frankly, your overall body, your overall health, because your skin, as you said before, your skin is a window to your overall health.
I don't think I could have said it any better. I think one area that we kind of didn't hit on, and you kind of mentioned it just now, is what are the personal care products that you're using? Are they naturally sourced? Do they have aluminum in them? Do they have tons of SLS and all of these things that we want to maybe avoid in our shampoos and soaps and body washes? Be conscious, be really, really conscious of what you're putting in and around your body, because it really is affecting the microbiome more. And that's what's creating a lot of these chronic conditions. I don't think I could have said it better, JP. This was a great conversation. I think a lot more fun than I expected it to be. And yes, you're right. We went off in all the different directions. So if any of this resonates and is relevant, please share this with that 1, 2, or 3 people who you think could really utilize this information to upgrade their health. And we'll catch you all on the next episode.